on the web and in your hands. This is MDiTV.
A new study shows women have more trouble than men with the procedure to correct an abnormal heart rhythm. In the research on more than 3,000 patients, the women had more complications and a higher failure rate with the type of catheter ablation. The procedure delivers radio waves to the heart muscle through the tip of a catheter.
And those radio waves work in a way similar to microwave. It heats up the fluid inside the cells and causes those cells to scar down. And in doing that, we can destroy electrical short circuits in the heart.
Patients needing ablation experience some scary symptoms.
I'd have a very rapid heart rate, and then I would usually get extremely fatigued and need to sit down or lie down for quite some time. And I would feel kind of cloudy in my mind, in my head. I couldn't always get my words out right after that. I think it was just very fatiguing on my body.
Amy underwent catheter ablation just a few months ago and didn't experience any complications for her condition, Wolff-Parkinson-White syndrome. The recent research published in the Heart Rhythm Journal looks at catheter ablation for atrial fibrillation. It showed a failure rate of just over 31% for women, compared to a rate of 22.5% for men. Uncomfortable complications were reported to be double the rate for women. The study also shows men undergo ablation for atrial fibrillation 5 times more often than women. Of the more than 3,000 patients studied over a 3-year period, more than 2,700 were men, 518 were women.
So why do we see more men? The likelihood of developing heart disease, which is one of the risk factors for developing atrial fibrillation, is greater in men and greater at a younger age. High blood pressure we more commonly see in men.
Dr. Halperin also points out women tend to be older by the time they experience symptoms and seek treatment. He believes this latest study provides an important reminder.
The results are not surprising. I think it's a good reminder to us to take extra precautions. I think it's important to let our female patients know going in. We always tell our patients what the risks of the procedure are, and I think it's important to tell them that the risks are slightly higher for these complications.
As for our patient Amy, she hopes the recent study pointing to gender disparity with ablation doesn't discourage women from having a procedure which has changed her life.
I have a lot more energy and don't have to lie down or feel concerned that I may have a sudden cardiac arrest, because that is one risk factor with the syndrome that I had.
Amy says she has an occasional palpitation, but that's nothing compared to the intense fluttering she used to feel in her chest before her successful catheter ablation.